Let's talk about feeling unsteady on your feet, and let's find the language you need to describe exactly what you're feeling. If you're going to see a physical therapist about feeling unsteady, it's important that you understand what is that sensation and what might be causing that sensation. It absolutely could come from muscle weakness. It could come from pain. It could come from delays in the nervous system, so things like peripheral neuropathy, spinal stenosis, or could be coming from the inner ear, so things like vertigo, BPPV. I'm going to show you a video clip of a client that I was working with who is experiencing unsteadiness on his feet. I'll explain exactly what he's feeling. I'll explain what we determined was the main problem, and we'll talk about some of the strategies that we're using to help resolve that limitation. So let me show you, let me pull it up on the screen. He's gonna take a right foot step. You can see how he loses it to the right side, right there. One more time for review. Now when he repeats the right step, no problem, totally steady. So the thing is, if he was experiencing something related to, say, peripheral neuropathy, the sensation, the information coming from his feet would not have changed that quickly. When a person with advanced peripheral neuropathy takes a step, they can't totally feel the ground, they're not sure. It's almost like they're walking on a cushion, and it takes a long time for that information to get to the brain. It's confused because of other sensations, which could be pins and needles, it could be pain, it could be numbness, tingling. When you're dealing with something like that, it's like that with every step. It's not like that with the first step and then it resolves for the second, third, fourth. Peripheral neuropathy is one reason why you might take that first step after sitting, feel unsteady, but then you continue to have that unsteadiness. I have other patients in the clinic with peripheral neuropathy. I should have thought about it, I would have gotten a video. In this case, it's also not a vertigo, BPPV, it's not an inner ear or vestibular problem because, again, once he takes that first step, his brain kind of figures out what's going on, then the second, third step, totally normal. It's not a strength deficit because if he was weak in the hip, he would be weak for all of the following steps. It's associated in this case with spinal stenosis and some chronic inflammation. When he takes that first step, especially because it's a longer than normal stride, we're forcing him to take longer strides. One of the things that happens is that first step, he gets an acute bout of pain, a quick jolt. It kind of throws him out of whack, but then the pain resolves and his second, third, and all subsequent steps are totally fine. We kind of narrowed the field. We narrowed the possible conditions or contributions to, it's not osteoarthritis in the joint of the hip because he's not feeling severe groin pain. He doesn't have any catching, clicking, popping. We know it's not peripheral neuropathy in the feet or the ankles because he has normalized sensation. We know that it's not vestibular inner ear problems because he doesn't experience any nystagmus or anything that would be suggestive of that. As we eliminate, we know that the hip itself is strong with independent strength testing. So as we eliminate all of these other variables, now we can make the determination, okay, when he takes that first step, he feels a sharp experience of pain that almost immediately resolves. And then the second step is completely pain-free, well-controlled, and he's able to walk 20, 30, 40 feet without any loss of balance or unsteadiness. These are the kinds of things that you're going to be doing with your physical therapist. These are the kinds of questions that your physical therapist is going to be asking and the assessment that your physical therapist will perform, not just on the initial evaluation, but likely every time you come in for therapy, there's going to be an assessment component to the patient care treatment. And this is what your therapist is kind of doing and thinking to help you figure out what is the root cause of the problem and what is the best treatment plan to resolve that problem.